What are the biggest challenges and pain points that you see in healthcare today?
They are creating a lot of documentation and a lot of back and forth, which clinicians are having to do.
A doctor gets only like 5 to 7 minutes to basically diagnose what the issue is.
We started off Dezy It as a design agency.
The great thing actually about it was we have been friends since college.
Where do you see AI working in healthcare nowadays? Welcome to this special episode. Today I have Indranil Roy, founder, and Aditya Tupe, co-founder. Do you want to add anything in your introduction?
Yeah, so we started off Dezy It as a design agency in 2019. Since then, we have been building a lot of solutions, got into healthcare 2 years back with conversational AI. So that is something that really excites us. And right now, we're trying to solve administrative challenges in healthcare institutions by building different kinds of AI automations.
The great thing actually about the two of us, we have been friends since college. So we kind of understand the know-hows, the positives and the negatives about each other, and we fill those gaps as well. So, I mean, like, it's a partnership for life, and we are also on the road to build something great. So it's a successful journey up ahead.
So speaking about administrative workload that you have just mentioned, what are the biggest challenges and pain points that you see in healthcare today?
So, speaking of healthcare administrative challenges, one of the big ones is obviously the growing cost. And also the amount of people that are required to service the clinicians. It is massive. And more so over a lot of these processes because of compliances, right? I wouldn't say that these compliances are not required. They are required to build and maintain a certain standard of care delivery, but at the same time, they are creating a lot of documentation and a lot of back and forth, which clinicians are having to do because of errors, small errors, like for example in the medical coding process, if an insurance fails because of a wrong code that was done somewhere in Sri Lanka by some third-party agency, now that going back, tracking and fixing that mistake is a huge cost. And I think these kind of errors are where which is creating a lot of the problem. You want to add something?
Yeah, another one thing which I actually feel is time.
Yeah.
Because you have 24 hours in the day, and the population is increasing, number of patients are increasing, the staff is also increasing, but on an administrative level. So I also feel that, you know, the care delivery side, the clinicians, the physicians, that is something which, and I've spoken to a few of them. They have also mentioned that at least the new generation physicians that are coming up, that they would also like to have some sort of a work-life balance. So how many patients can they attend to? How many procedures can they do? How much time does each treatment take? All of it is based around time. So I also feel that is one of the main areas.
Yeah.
And I was also speaking to Dr. Pannu the other day, and he also mentioned that like in average 30-minute consultation, a doctor gets only like 5 to 7 minutes to basically diagnose what the issue is. Rest, everything goes around educating the patient, and then the remaining time, documentation and everything. So he gets a very less time to actually do what is supposed to be done.
Exactly. And average, like we've had so many conversations with different kinds of doctors from different specialties working in different kind of systems as well, you know, whether it's NHS, whether it's a private system, whether it's a small practice. And a standard theme has been that most of them spend at least more than 30-40% of their time on documentation and on administrative things that are actually not, you know, like you said, patient communication I still feel is an important part, because hey, if you're dealing with, it's a person-to-person affair, right? So if you're dealing with another patient, you having to address their problems is obviously one part of the care. But you having to sit and now file a report and make sure that the report is being filed properly, and then figuring out the code and make sure that is being done properly, and all of this is I would believe overhead burden, you know.
Yes.
Yeah. We have a lot of buzz like around AI, specifically in healthcare nowadays. So, where do you see AI working in healthcare already?
So AI in healthcare, obviously, there are a lot of different use cases that are coming up. We ourselves are also builders of some of those use cases. We have a lot of competitors that we have studied closely, and in the conversational AI space, where they're building different kind of patient engagement solutions, insurance solutions, and things like that. But something that we are that is already and everything from diagnosis to decision support to image processing and coming up with again decision support, population health, all of these, there are massive scopes of AI and there are a lot of things being developed. But what has already been commercially being implemented and being seen deployed in institutions at a pretty large scale is what they call as ambient AI, you know, which you don't feel, which you don't hear, and a classic example is AI scribing. That's something that is very popular, being used almost very frequently in institutions, and has massive benefit. It cuts down a lot of the documentation time, post a consultation, post a visit, and also from there stems other workflows. It's able to take that information, process it, and also pull out codes and things like that. That's, I think, one of the examples that I have noticed quite a bit.
Yeah. Scribing actually is pretty interesting, what they have been able to do, and just a doctor writing that report, or any nurse or any physician writing that report is, the time which could have gone to attending a patient. So I'm sure, like modern technology, we have been hearing about so many uprising technological advances, like drug discoveries and identifying if some sort of a disease, you can have an early detection of diseases as well. But we also need to see the patient engagement level. What is the first thing when a patient comes into your clinic? What is it that they do? They speak to the receptionist. They sit down, they wait for a moment, they have the patient intake process. They go into the doctor's room, and that's how their entire cycle looks like within a few minutes, I would say. So just looking into, as you said, which areas of how can AI affect healthcare, or how can it impact it, or how can it actually create a bigger impact in the future. I feel that this experience needs to be made better.
So adding to it, do you also feel that AI is misunderstood, or let's say underused in terms of how capable it is?
Oh yes.
Yes, and I mean, definitely the answer, like a one-word answer, would be yes. But to expand on that, I'd say one is the know-how. Obviously, there are builders. Okay, there are technologists building some crazy stuff using AI for healthcare, and there are also a lot of those have gone into trial. So that means there are also health institutions that are implementing these kind of technologies and are experimenting with these kind of builders to build the future of healthcare, right? I think a big concern is obviously the know-how, but more than that, the thing is there's a fear. And two of the main fears that I would say is over-dependency on a system that's like a black box, because they don't know what's going on inside. How is it, it's providing this decision support, or it's able to do radiology scans and come up with a report that's 99% accurate, but how? So now you're getting dependent, as a clinician, you're getting dependent on this technology. But until you know how it's doing it, it feels that you're getting dependent on something that you don't completely know about.
Exactly.
And the second thing is obviously the privacy and security concerns regarding data. And I mean, I think nobody better to talk about it than Aditya.
Yes, from a security level, like all data needs to be protected. And this data, even if you feel that is being accessed by elsewhere. Your system needs to be like 100% bound. No data leaks, no breaches. It cannot be attacked from any side. So your system needs to be like a very strong unit. In a way, I feel that if AI is being misunderstood today because people have not seen the capabilities of it actually.
Yeah.
People do see it as, hey, it's a software, it's a system, it's something robotic. If I'm going to pick up the call, or if, let's say, I want to speak to an AI, they're going to be like, something robotic is going to speak to me. Would it be a human sound? Would it sound like a human, or is it an AI? That's the bigger question actually. And just overall in an interaction, today, like the three of us are sitting here, we are speaking to each other, a person to person to person.
Yeah.
Now, AI is something which is new to the world. A lot of people do not understand that. So, in that way, I feel that just the acceptance needs to come in first. That people start seeing it, they start visualizing it, they start understanding that AI is not robotic. AI is not something which is going to sound like one of those recorded messages that you hear over the phone call, and it's just going to be a 30-second audio recording, and then you keep the phone. Now you can actually converse with it. You can speak to it. You can, and within the healthcare industry, you can actually, if you're booking a consultation, or if you're actually wanting to meet the physician, you can express your symptoms to the AI first, so that they can have a brief summary to pass it to the physician as well.
Definitely. And I want to also know the examples like that you have seen. Like, can you share some of the examples of AI helping in healthcare if you can?
So one that I would mention, which I recently came across, was in radiology. So you have to create reports after every scan, and that report is again a documentation. We already spoke about scribing. So similarly, another documentation process on. There is this is I think for Apollo. I know the person who's building it. So they are basically. They have 50 radiologists, they're in a shortage, they have more scans than they can handle, they're looking at scaling up the team, they brought in an AI image processing and reporting tool, built one customized for their workflow, and now with 50 people, they are able to do what a 250 people team would be able to do. So those kind of use cases where it's augmenting staff, current administrative staff, to do almost 5 times more than they were able to do yesterday. Just because of having artificial intelligence at their disposal.
And that's really important, because now the world has also come to a stage where if you required a service, earlier it would be that you would get the service within days. Then it started reducing to a few days, to a few hours, and now it's come to minutes. So if each and every minute can be utilized, that is what this AI can do. Each and every second, every minute, it can process information which a human may not be able to do at that level of efficiency.
Right. Talking about the use cases that we are also doing, right? So AI calling, for example, when we got into conversational AI, I mean, you were there, so we all did it together, and it was like wow. When the first time we built a talking avatar, we had it in our hands, we spoke to it, and we were like, what? What is this? This was like magic.
Yeah.
It was magical. And now also with these calling solutions, and it's getting more and more prevalent in systems, especially in the West, and it's great. Like it has consistency. Your AI doesn't have a bad day. It doesn't get moody. It doesn't get tired. A lot of the documentation things it's able to do, so much more. And with so much less, so that's the true power.
Speaking about that avatar, conversational AI avatar that we built, I think it also helped in making the piece of healthcare accessible to the target patients or the target customers, right? So that was also a very big deal.
Absolutely.
And I want to circle back on the previous question. So we have spoken about the challenges and we've spoken about the impact, but I want to also understand that this admin burden is not a new thing, right? It's been there for a very long time. So why do you think that it's basically there on the table from a very long time? Like, what is the thing that can make it more, let's say you can reduce like on a faster scale rather than it's being there on the table for a long time?
So for that, actually, if you go with the statistics, in the last 50 years, we have seen a rise, and this is in the US. So we have seen a rise in the number of doctors, and that's come up to about 200% in the last 50 years.
Yeah.
But administrators, they have increased by 3,800%. So we understand that for every physician, there is approximately 10 to 15 administrators. And that is creating that, a cycle of administrative tasks, things which could have been done better or faster or more efficiently or else without any errors or mistakes. That is creating that bubble of costs which comes in. So I'm sure there are so many other competitors, there are so many other people who are trying to come up with these solutions as well, and we are one of them too. So we feel that our solution could be better. It could have that voice that a person, when they listen to, when they speak to also, they would also feel at ease. They're not feeling that I am. Yes, exactly.
Yeah. So to add to that, definitely we all know it's a growing problem, and like coming back to your question, that why is it still there? Like it's not like the problem came up yesterday. It's been there for decades now. So why isn't something happening about it, right? Like, one is obviously with technology, with cases that are creating issues, compliances are increasing, documentation standards are also increasing, and a lot of these compliances are not very easy to navigate. So to make sure you are compliant, you have to follow these things. And that is where the administrative burden is coming from, right? Now, how do you solve it? As technologists, the only way we know how to solve it is with technology.
Exactly.
If not technology, how would you solve it? You would solve it with a process, and you had people to get you to solve it. And that's how people have been solving it. Now that adds cost. Every time you bring in another person, and if to cut those costs you try offshoring, then that cuts quality, and then errors is again cost, like we spoke about earlier, right? So, and has technology been there? Like, as technologists, we've been in the industry for about a decade, and we've been seeing all kinds of technologies evolve over this decade, right? And conversational AI, at least, it wasn't there. I mean, it was nowhere close to what it is today. And I'm sure what it will be in 6 months would just blow our minds, So it's just evolving so fast. So the technology wasn't there yesterday. So a lot of these processes aren't very easy, like that you can automate it very simply. A lot of it that can be automated is being automated.
Yeah.
But a lot of it couldn't be automated, which now can be.
Definitely.
Because of artificial intelligence. Because of artificial intelligence, we now have the ability to build kind of solutions that will automate a lot of these complex administrative workflows that just wasn't possible yesterday because we didn't have access to that kind of technology. Now there are builders who have access to it. The technology is getting more affordable, more affordable and accessible and compliant and secure, so that it can be used. And even there's a mindset shift. Like, I was talking to somebody the other day, and he said about this the HIMSS conference that happens every year, and apparently last year's conference, most people were talking about when their topic, obviously AI in healthcare is not a new topic, and everybody's talking about it for the last couple of years, and when that topic would come, everybody would be like, oh, is it secure, is it safe, is it... Today, nobody's questioning that anymore because there's just so...
mass adoption happening.
There's adoption happening, and there's mass adoption happening of at least some solutions. So now everybody is asking, hey, how do we get in? Where should we start? What to do? How do we, just to make sure they're not left behind. So it is, now it's happening. And I'm sure that with all of this, it will start easing up and the burden will go down.
Definitely. So my last question would be that what excites you most on what you are building right now, what we are building right now as a as an organization?
If I had to term it in one word, it's value.
Definitely.
Any sort of value that we can provide, and we are tending to the healthcare industry, so it's going to be towards all those physicians, each and every operator, each and every person, a human being that is there within that industry. We want to provide that value for those care providers, for the people who do not, either are not able to find that time, either they are so packed with all of this documentation and workload, this administrative workload that we have been speaking about. So I feel that if all of us, being technologists, we build something that could come of use to them, it would be my immense pleasure to have them on board, onto our platform.
Definitely.
And this is something which I feel that it's going to be there in the long run. So it is something we are also planning to build forward. We have built a few segments out of it. We are planning to build a few other segments of it, and that is going to encompass our entire AI stack.
Yeah.
For me also, it's quite personal. My grandfather was a esteemed neuropathologist. My dad's a technologist. I'm a designer. I just feel like it's legacy. I'm born to build in this space. The moment we got the opportunity, it just happened that we got the opportunity to serve in the healthcare industry. But the moment we entered, I was like, this is my calling,
Yeah.
And now also what excites me the most is that, obviously, one word, value, but it's saving lives, right? Like doctors are saving lives, and the healthcare industry exists to save lives, to make sure people are healthier. And one of the opportunities that I'm very personally passionate about is also preventive healthcare, because I believe that the best kind of health outcome is if you don't have to go to a health institution, So I also see that tomorrow AI will be able to provide access to a lot of, I don't know whether it would be knowledge or actions and just guidance and motivation to create a healthier tomorrow.
Definitely. And I want to quote that statement that we were discussing the other day, right? That if you take care of people who are taking care of people, the system will improve. Right?
Yeah.
Definitely. That's what our values also reflect.
Yeah.
That we are saying that we exist to create value. Right. So yeah.
And saving administration time, saving clinicians time, making their lives a little more comfortable, like you said. Take care of the people who are taking care of the people.
Yeah.
So that is definitely one of the big motivation factors.
So thanks Indranil, thanks Aditya. It was great speaking to you.
Thank you for all of those who are viewing.
Thank you, everyone.